Next up, we're going to be breaking down the skeleton into two different systems. We have the axial skeleton and the appendicular skeleton, and we're going to be looking at each one of those individually. So here is our axial skeleton. This is going to contain the bones of the skull, rib cage, and the sacrum. You can see that over here. We've got the skull and the vertebral column as well in the back. This is our axial skeleton. The appendicular skeleton is going to consist of everything else, and we will get into that in our next section. But starting off with our axial skeleton, there are 206 bones of the skeleton are going to be classified into either the axial or the appendicular skeleton. Now, just as an overview, the axial skeleton is going to be the midline of the body. It's going to consist of the skull, hyoid bone, vertebral column, and the rib cage. Now, the skull itself is going to be formed by the cranium and the facial bones. The cranial bones, that'll be the cranium that is formed from 8 or sometimes more flat bones. This is going to be responsible for protecting the brain, housing the structures of hearing, provide an attachment site for muscles of the head and the neck. In adults, this is going to be made out of 8 bones. In newborns, the cranial bones are joined by membranous fontanelles. So that's going to be sort of spongy membranous tracts in between the bones. Usually those fontanelles are going to close shut by the age of 16 months. Found a little bit lower than that, we're going to have the facial bones. Now, the facial bones are going to be 14 different bones that support several sensory structures. They're also going to serve as an attachment site for most of the facial muscles. So here we're going to sort of break down the different bones found in the face. Like I said, the cranium is going to be made up out of 8 different bones found in adults. Those bones would be our frontal bone right here, the parietal bone up here, the occipital bone back here, temporal bone right in here, and the sphenoid bone. The sphenoid bone is going to be found right here, and the ethmoid bone found right deep inside that sort of eye socket. We're going to also see the foramen magnum. That's going to be a hole in the occipital bone right back here. Underneath. So it'll be right back in here and underneath. Here is the foramen magnum. This is going to be the hole in the occipital bone through which the spinal cord passes. So this is going to be the junction or the point of articulation between the head and the spinal cord. We're also going to see the external auditory canal. That'll be found right over here. And this is going to be located in each temporal bone. So found on either side, you're going to have this external auditory canal. It's going to lead into the middle ear, and we're going to talk about that quite a bit when we talk about our different senses. The sphenoid is going to complete the sides of the skull and contribute to forming the orbits or the eye sockets found right in here. And the ethmoid bone also helps to form the orbits and the nasal septum. So that's the ethmoid bone right back in here. You can see that little red region. So here we have the bones of the face. So we've kind of gone through the bones of the skull. Now we have the bones of the face. We have the nasal bone right in here, the zygomatic bone, maxilla, and mandible. Inside of these, especially right up here inside the face, we're going to find sinuses. Sinuses are going to be air spaces found in some cranial bones. These are going to be lined with the mucous membrane. It's going to help to reduce the weight of the skull, and it gives a resonant sound to the voice. They're going to be named according to the bones in which they are located. So we have the frontal sinuses found in the frontal bone, the sphenoid sinuses found in the sphenoid bone, the ethmoid and maxillary, I'm sorry, that word is very difficult today. Maxillary sinuses found in the maxillary bone. We do have a smaller set of sinuses called the mastoid sinuses. They're going to drain from the middle ear. Mastoiditis, if you've ever heard of that, that's inflammation of those sinuses. So here we have our facial bones. We have the mandible and the maxilla, mandible, maxilla, zygomatic, and nasal bones. The mandible is going to be the only movable bone in the skull. All the other bones in the skull are immovable. They have immovable joints between the various bones. The maxilla is going to form the upper jaw and form a portion of the orbits or the eye socket. So here's our maxilla. The hard palate and the floor of the nose are going to be formed by the maxilla joined to the palatine bones. The zygomatic bones are going to form our cheekbones. The nasal bones form the bridge of the nose. And there are other bones like the ethmoid and vomer bones. They're going to be part of the nasal septum, which is going to divide the nose into two internal nasal cavities. The lacrimal bone contains the opening for the nasolacrimal canal. That is what's going to be responsible for draining tears from your eyes into your nose. This is why when you cry, your nose runs, because the excess tears do leak out of your eye, come down your face. But most of those tears are actually going to backwash down that lacrimal canal and come to the nose. The last bone that we really want to mention in sort of this upper region of the head, face, and neck would be the hyoid bone. This is not part of the skull, but it is part of the axial skeleton. It's the only bone in the body that does not articulate with another bone, so it does not touch, connect, or move against another bone. The hyoid bone is going to be responsible for anchoring the tongue, and it serves as the site of attachment for muscles that are associated with swallowing. In cases of suspicious death, a fractured hyoid is a strong indication of manual strangulation. Moving down from the skull and cranium, we're going to move into the vertebral column. The vertebral column is going to consist of 26 vertebrae. The first 7 are going to be the cervical or the neck vertebrae. These are conveniently named C1 through C7 for the 7 cervical vertebrae. The next 12 are going to be the thoracic vertebrae, or your chest, found in that sort of chest cavity region. These will be T1 through T12. Then we have the lower back region, the lumbar region, where we have 5 vertebrae, L1 through L5, followed by a single sacrum and a single coccyx. The sacrum is going to be formed by the fusion of 5 different sacral vertebrae, found right down in here, and the coccyx is going to be the tailbone. It's formed by a fusion of 4 different vertebrae. Since they are completely fused, we just refer to them as the sacrum and the coccyx, and don't break them up into S1 through 5 or C1 through 4. That would be confusing with the upper cervical vertebrae. Between each of those vertebrae, we are going to have what are known as intervertebral discs. These are going to be composed of fibrocartilage, and they're going to help prevent the vertebrae from grinding against each other when we move. They're also going to be responsible for absorbing shock caused by movements like running, jumping, or even walking can be very shocking to the system. So they're going to allow for some cushion absorption. They also allow the vertebrae to move as we bend forward, backward, and from side to side. Now, unfortunately, over time, they can become weakened with age, and they can herniate or rupture. So you may have heard of somebody complaining of a herniated disc or a ruptured disc. This is going to be damage to that fibrocartilage pad between the various vertebrae. Pain results if the disc presses up against the spinal cord or if it presses against other spinal nerves. It can become a very, very painful situation. All right, so moving forward from the spinal cord, we do have the rib cage. The rib cage, also known as the thoracic cage, is going to be composed of the thoracic vertebrae, the ribs and their associated cartilages, and their sternum. So this is considered part of the axial skeleton. It's going to be responsible for protecting our heart and lungs, and it's going to swing outward and upward upon inspiration and then down and inward upon expiration. If you remember from our discussion on the respiratory system, the rib cage is going to be the area that moves up and out when you breathe in and down and inward when you breathe out. So here is going to be that rib cage. There are going to be 12 ribs. All are going to be connected directly to the thoracic vertebrae in the back. So right back here is where we're going to see that connection point for each of those 12 ribs. Each rib articulates with the body and the transverse process of its corresponding thoracic vertebrae. So it's going to move with the body and with the rib on the other side. So we have, rib 5 over here. It's going to move in correspondence with rib 5 over here on this side. Now we do kind of separate the difference between true ribs and false ribs. True ribs, ribs 1 through 7, connect directly to the sternum by means of a long strip of hyaline cartilage that's called a costal cartilage. So that region right here, this is our costal cartilage. Our true ribs are going to connect to the sternum. We do have what we also call or refer to as false ribs. Those would be ribs 8 through 11. 8 through 11 or 8 through 12. These are our false ribs. They do not connect directly to the sternum. Instead, their costal cartilage connects to one another and then branches up, connecting to the sternum. There are also floating ribs. That would be ribs 12. They have no connection to the sternum. Actually, 11 and 12. 11 and 12 do not connect to the sternum at all. The sternum is going to be our breastbone. Along with the ribs, it helps protect the heart and the lungs. It's going to be composed of 3 bones, the manubrium, the body, and the xiphoid process. The manubrium articulates with the clavicles up here and joins with the body of the sternum at an angle. Counting the ribs is sometimes done to determine where the apex of the heart is located. Usually it's going to be located between the 5th and the 6th ribs. The xiphoid process serves as an attachment site for the diaphragm. So the xiphoid process right down here, this is where our diaphragm is going to be attached. That's going to pull down to allow our lungs to fill or allow our rib cage to expand outward and upward. And then when it relaxes, it's going to push our rib cage inward and downward. So that diaphragm that's going to be found right up here, that's going to separate the thoracic cavity from the abdominal cavity. So the lungs would be found not north, but above, superior to the xiphoid process, and our stomach and intestines will be found beneath that. All right, so now you should be able to list the bones of the axial skeleton, identify the bones of the cranium and face, describe how they contribute to the facial features, and describe the various types of vertebrae.